A patient is unhappy with their treatment. They demand a refund, threaten to contact the dental board, or tell you they're going to sue you. But does that automatically mean malpractice occurred? No. For a dental malpractice claim to succeed, the patient generally has to prove four separate elements: duty, breach, causation, and damages. And if one of those elements is missing, there may not be a valid malpractice claim. And that's what we're going to talk about today. So stay tuned. Hi, my name is Orrin Pearson, Vice President of Insurance by Dentists and author of the book series Insurance for Dentists. Today, we are going to break down the four elements of a dental malpractice claim and explain what they mean for you as a dentist. Before we get into those four elements, it's important to understand the standard of care and what it is. The standard of care, as many of you know, is generally the level of care and skill expected from a reasonably competent dentist under similar circumstances. It does not require you to be perfect. Dentistry involves professional judgment, and two dentists may reasonably approach the same case differently. More than one treatment option can fall within the standard of care. A poor result or recognized complication does not automatically mean that you were negligent. The real question is whether your decisions and actions were reasonable based on the information available at the time. Now let's look at the four elements a patient generally must prove. Element 1: duty. The first element is duty. Duty is established when a dentist patient relationship exists. Once you agree to evaluate or treat a patient, you take on certain professional responsibilities. Those responsibilities may include properly evaluating the patient, exercising reasonable clinical judgment, maintaining confidentiality, and communicating important information, and providing appropriate follow up care. Duty does not mean that you have to perform every procedure a patient requests. You can decide that a treatment is unnecessary, unsafe, or outside of your experience. In some situations, the appropriate decision may to be refer the patient to a specialist. Your responsibility is to exercise sound professional judgment and act in the patient's best interest. Element 2: breach. Breach is the second element. A breach occurs when the care provided falls below the applicable standard of care. This can involve doing something that should not have been done or failing to do something that was necessary. Examples could include treating the wrong tooth, failing to identify suspicious pathology, failing to obtain informed consent, and not responding appropriately to a complication. However, simply making an error does not automatically establish malpractice. The patient must still show that the breach caused them an injury. In a malpractice case, another dentist may review your records, diagnostic images, treatment plan, informed consent forms, and follow up care. That expert may then offer an opinion about whether your actions were reasonable under the circumstances. This is why documentation is so important. Your record may be reviewed months or even years after treatment. A complete record helps explain what you saw, what you discussed, what you recommended, what the patient decided, and why you made the certain decision that you did. Your notes should tell the story of the patient's care. The third element is causation. Causation connects the alleged breach to the patient's injury. Even if something was handled incorrectly, the patient generally must prove that the mistake caused or materially contributed to the harm. For example, imagine a patient with uncontrolled diabetes experiences delayed healing after an extraction. Was the complication caused by the treatment? Was it caused by the patient's medical condition? Did the patient fail to follow post operative instructions properly? Were there multiple contributing factors? The existence of an injury does not automatically establish what caused it. This is often one of the most disputed parts of a malpractice claim. Patients can also contribute to an outcome by missing appointments, refusing treatment, failing to take medication, or ignoring post-operative instructions. When that happens, document the instructions you provided, the risk that you explained, and your attempts to follow up. The fourth element is damages. Damages are the actual losses the patient claims resulted from the injury. These may include additional medical or dental expenses, lost wages, future treatment costs, pain and suffering, emotional distress, or loss of normal function. Without actual harm or loss, there may be no practical basis for a malpractice case. For example, a patient may be upset about a bill and threaten to sue, but a billing disagreement alone is not necessarily dental malpractice. The patient would still generally need to show that there was a professional duty, that the standard of care was breached, that the breach caused an injury, and the injury resulted in damages. A complication is not automatically malpractice. Dentistry carries inherent risk. A patient can experience infection, implant failure, nerve injury, persistent pain, or another recognized complication even when the treatment was performed appropriately. That does not automatically mean malpractice occurred. The legal analysis still comes back to the same four questions. Did you owe the patient a duty? Did your care fall below the standard? Did the breach cause the injury? And did this patient suffer actual damages? This is why informed consent matters. Informed consent does not protect negligent treatment, but it can help demonstrate that the patient understood the material risk, benefits, alternatives, and possible outcomes before agreeing to a procedure. Understanding duty, breach, causation, and damages can help you evaluate patients' concerns more clearly and build stronger risk management systems within your practice. You may not be able to prevent every complaint or complication. However, you can reduce your exposure by staying within your competence, referring when appropriate, maintaining complete records, improving your informed consent, following up on complications, and reporting potential claims to your malpractice insurance company promptly. I'm going to wrap up today's video. Thank you for watching. If you ever have any questions, please reach out. My name's Warren Pearson, Vice President at Insurance by Dentist. Have a wonderful day, and I'll see you in the next video.